Hi, Peter. Hi, how are you doing today?
Yeah, good.
Good.
Yeah.
Well, as you know, we finished our anamnesis and diagnostic part in our previous session. So today we're going to do a treatment session. So basically, what I'm going to do, I will talk about pain illusion. While I'll ask you some questionnaire, and then after that, I will try to change your point of view about pain. So, okay, last time you told me that, and I have seen that you have a problematic because of pain with your daily life activities. So, could you please tell me, like, in which activities you feel more pain?
Yeah, first of all, if I start with my working position, so I work in a I work in a warehouse. So every day I need to lift something from the floor, everywhere. So at the time of lifting, it's so painful for me. And also I need to sit in my home for seeing television, watching television or something like that. So that I'm sitting for a long time, it's also painful. And also sometimes I want to do my gardening because it's my hobby. So at the time gardening is also painful. I don't know why. Yeah, that's it.
Okay, and tell me more about, like, for example, why do you think and what do you believe because of why it's painful?
Yeah, this question also came in my mind.
Yeah.
So I researched in Google or YouTube for that.
Yeah.
I found something, but I'm not convinced.
What did you find something?
I saw some videos, someone stating like pain is normal for human body. One time it can come and what time it can go. So without any reason it can come also. So there's nothing evident. I didn't find any good evidence.
But why?
Evidence.
And why do you think because of your, like, what do you think about your pain? Like, what do you think about your pain coming from, and what do you think that your pain affecting your daily life activities? You say, like, just share your thought. I just want to know, like.
I thought my pain will damage my back. It's my main thing. Whenever it came first, I thought it will damage it will damage my body, and suddenly I felt a lot of pain. So I felt that it's not good for my body.
So you are worried and stressed about this.
A lot.
Okay. Okay, and okay. So you are stressed and worried about your pain that you mentioned, right?
Yeah.
Well, you have been like pain more than 3 months, and you are in a chronic phase, you know.
Yeah.
So in that case, like when in terms of chronic pain, it's happened like our body over and over time, and then our body is sensitized, and basically our body become like sensitive. So for example, think about like the car. So if you park on your car outside and it has a like alert alarm, right? So if someone going through this car and if by chance they touch their car, what they gonna do? What is gonna do? Shut their alarm, right?
Yeah.
Why? Because maybe it's telling, or it's thinking maybe someone is stealing their car or trying to harm his car, but exactly not.
It was not. Yeah.
So same thing like our pain. So while we thinking something, our brain signal gives signal that there is something wrong, and pain is normal. There is nothing like always about tissue damage. Pain is normal and it's really on context. For example, if I tell you another story. For example, if your childhood, when you're a child and you're going through beside your house road, there is kind of like grass or something, and if you buy one snack, and then it's very painful, right? But if you go again same road when you grow up or something like another day, if there is no snack, but your brain gives you the signal there is something wrong, you have to be alert.
Yeah, that's true.
So this is like our psychological thing. Brain give you signal that there is something wrong. You have to be alert. So there is nothing. There is nothing wrong, right?
Yeah, even though there is nothing, but
but it's still giving the signal.
Okay.
So our body give you the signal, something like that, because of the sensitive thing.
Yeah, now.
Yeah.
Yeah.
And the second thing, it's, yeah, I mentioned that it's all not about like tissue damage, and there is also not like something serious. There is something that detect our brain and then give you signal. Yeah, and also the another thing about your disc degeneration, that I have seen that you went to a neurologist and they have a problem with L5 and L4 disc degeneration, and normally in this chronic phase is normal, and the pain is normal, in this phase, and at your age, especially at your age level, this is normal. Yeah, you understand? Okay, I'm gonna ask you more couple of questions about your pain, you said like affect your daily life activities, yeah, and also gardening, and also you said lifting something. Now, how it's affect with your emotion? Is it affect with your emotion?
Yeah, whenever, because I have lots of issues, I told you before. So also I live alone, but I got divorced recently. And so whenever I think, because at the time of working, all of a sudden it came my mind that I have lots of stress and I'm divorced, I'm alone, my life is not going well. Yeah, it can.
I'm sorry to hear.
Yeah, but I think it can be cause of, I don't know, I'm not sure, but I think it can be.
Yeah, because also sometimes we lost someone in our life, personal person, or we also emotionally attached. When we remember their memories, it's our tears automatically come in our eyes.
Also, one thing I also want to mention, like I can lose my job because now I can continue my work because it's so heavy for me. This also came in my mind that okay, one day my manager will find me because I'm not working now, because I stop, because the time I'm working I feel that it's so painful, so I stop. I think I will damage my back, that's why I stop my work also.
Oh, okay.
There are lots of things coming in my mind.
I'm sorry to hear, Mr. Peter. Well, besides your job and other thing, personal life thing, how about your your home? How about your home situation, your relation?
I told you, my relation with my wife and with my children is not going well because they leave my home and they starting living in another house. So I'm alone now.
So also, you also have very stress from your home also, right?
Of course, there is.
Well, I'm sorry again. So my next question is: there is any friend or your family members that support you during your emotional or
on the time?
emotional? They give you like emotional attachment. You know what I mean? Like during a bad time, they make you like less stressed. There is something, or you are joined with any social group, because there is many social group that they help people who are going through this emotionally.
Still, I didn't try, but I don't know it will be helpful for me or not. I don't know that.
Well, I can maybe help you with this thing. So I can do one thing for you. So I can give you some relaxation exercise. For example, meditation or breathing technique that will make you feel like less stressed. And I can also help you, as you mentioned, you register.
So you mean? Oh, sorry to interrupt.
Yeah,
you mean also stress can be happen for my pain?
Yeah, of course. It's all related with pain. It's related with emotion, stress.
I need to reduce my stress.
When you reduce your stress, your pain will be decreased also, because it's all related with it's all related with our connection. So I can also help with your. I can add you some group. There is a group. They do social work and social thing. So you can spend your time. So you will not feel lonely. So when you will be busy, maybe you feel less pain. Yeah, is that okay? Sounds good.
Yeah.
Okay, another thing about your deconditioning. As I know that you have been doing not too much moving or doing thing, you
No.
doing less thing.
I
So
totally disagree with
you
that.
like,
Yeah, I don't like to move now because
yeah,
it's painful.
because you think that, or maybe if I move a lot, maybe there's something broken.
Yeah,
But
yeah.
you know that now I mentioned that about pain is not about tissue damage and how it's come
Yeah.
from our brain give you signal, no? So I would say in that case you have to like little bit you have to move little bit gradually. So I would say for this for this part I would choose like graded activity, where I will help you to move gradually, increase your activities step by step. For example, day by day, week by week, little by little, step by step. You don't need to do at the same time the heavy thing. You know what I mean?
Mm-hmm.
So, but please try to keep active, not avoid everything, because when you keep active, your muscle memory also be active, and you will be like active like before. But if you stop everything, then it's like would be problematic. So for this thing, I will help you. For example, you have like the weaker core muscle, so I will give you some core muscle exercise. And for graded activity, for example, especially have a problem like sitting and lifting, right?
Mm-hmm.
So for example, I will, like you said that you have a problem with lifting something from the ground.
Mm-hmm.
So okay, I will help you with one thing. For example, I will make it easy thing. So for example, I will set something to pick up from the certain level, like easy level.
Mm-hmm.
So I will start with easy level. When you will do more time, you will get your confidence will be like increase. Understand?
Yeah.
And then when you will confidence will increase, then you will do the little bit harder, and then certain time you will get your pickup point.
Yep.
And also during your sitting. So for example, during your sitting, you have to just if you have a problem with your like low level sitting, so I will make it a little bit high weight for you. So sit for a little bit and take a break, not for a long time because you have a problem with long time problematic. So you take for example 10 minutes, 15 minutes, and it's done. Take a breath, walk a little bit, and then again sit down. So if you increase like your fear of movement and that you thinking about pain,
Mm-hmm.
so because of doing this graded activity, step by step, your confidence will increase and you will be active. Yeah, you understand?
Yeah.
So yeah, that was thing that I will give you some relaxation, meditation, breathing technique, and little by little. Also, you can do some walking, little by little. For example, 3 or 4, 10 minutes or 5. Okay, start 5 minutes.
Mm-hmm.
5 minutes walking, maybe 3 days, 4 days in a week,
Mm-hmm.
and then gradually you will increase. So your fear will be gone. Yeah, it sounds good.
Yeah.
So that's it. Do you have any question for today?
I think everything is clear for me.
Yeah?
Yeah.
So I will send you the document about whole exercise and everything, how you can do and how and when you should do,
Mm-hmm.
and how many set repetition. I will everything send it to you, and then we will see our. I forgot to mention the graded activity is like a 3-month course.
Mm-hmm.
So we have to do is 3 months. So within 3 months we will divide it. For example, from next week we will start, and then our goal. For example, our goal, as you mentioned, and I see when you do lifting and bending, your pain was like 9-10, right?
Mm-hmm.
So what do you wanna expect from me within 3 months? Your pain should be like which level you want?
I think I expect at least 4 or less than 4.
4. Okay, that's good. Nice to hear. At least
Is it
you,
doable?
at least you didn't say 0 because 0 is unexpected. It's
of course.
unrealistic.
Yeah.
So it's not with our hand. But 4, yeah, it sounds good. So I wrote it down and we will work on it together. Yeah.
Okay.
Okay. Do you have any questions, Sister?
Mm-hmm.
If you have any question, just send me a message,
Mm-hmm.
note me, and then we'll talk. So see you next time. Yeah.
Yeah.
Thank you so much. Have a nice day.